Welcome everybody today. This is the first webinar for the American Academy of Medical Hypnoanalysis. And this is, I'm your moderator. My name is Wendy. So let me know if there's anything I could do to make your visit with us a little bit more pleasurable. You can message me. There are little places where you can send a message to the general group. Or let me know if you can't see something or you need to send a message to somebody privately, that's okay as well. Our panelists today are Jeannie Clark, Dawn Hardy-Holly, Dr. David Leskow, and today we are going to cover a brief definition of hypnoanalysis, and we're going to cover a little bit about what happened at our annual conference last year. And then if you want to know what happens after the conference, we are going to talk a little bit about the training and residency. Jeannie will wrap it up with any last thoughts to make sure that we covered all topics. And then we're going to have an open Q&A to get any of your questions, concerns addressed. Go ahead, Jeannie.
So I'm Jeannie Clark. I am an LCSW, and I've been practicing hypnoanalysis in the western suburbs of Chicago since, I think it's been about 2002. And I'm also currently in a Doctor of Social Work program and am partway through my dissertation process studying hypnoanalysis. So part of what I'm going to be looking at today and sharing with you very, very briefly is some information that I've been discovering in my research. And the first thing that, one of the questions that has been weighing on me, and one of the reasons why I wanted to do this program, was the question of why don't we use hypnosis more as a treatment tool? And one of the things that I found was that there is a tremendous amount of history related to hypnosis and antecedents of hypnosis. And a lot of really good science has been done. And people historically, dating back to, our revolutionary time and in Europe, people got extremely excited about what was going on in hypnosis. But what kept happening was social, political, and professional factors kept intervening and sort of sidetracking hypnosis. The other huge problem was that people did not understand what was going on. Even back as far as the late 1700s and even earlier than that, people would get absolutely extraordinary results. And because they didn't understand what it was, they would invent reasons for what they were seeing that end up now being biases, in fact, all of which have been debunked. But those biases continue to persist simply because it's a kind of wisdom or opposite of wisdom that gets passed down from generation to generation. Next. So what neuroscience has been finding is basically it has confirmed that hypnosis is a neurologically identifiable state. So, there's been a lot of debate. There continues to be a debate about the nature of hypnosis, but there's pretty good consensus that it is a neurological state. It's brain-based. The other thing is that with different kinds of research, it's confirmed that brain areas implicated in a lot of mental illness can be influenced during hypnosis in ways they can't in talk therapy. And hypnosis can influence functional areas of the brain in healing ways that neither talk therapy nor medication can address. And so this really gives us the opportunity to do interventions that talk therapy and medication can't do. So switch to the next one, Wendy. This next slide simply shows us a list of brain areas that I've been able to identify in the research that can be influenced, either increasing activity in the brain areas or decreasing activities in the brain areas using hypnosis. The next one. One of the things that there's pretty broad consensus, very broad consensus, that hypnosis in itself is not healing. Just getting into hypnosis isn't going to cure anything. And often hypnotherapy, and the way I define hypnotherapy is giving somebody direct suggestions. Often that alone is not healing. I'm not going to go into details about why, but it just doesn't do it. Basically, what researchers are saying, what writers are saying in hypnosis is that in order to be a good hypnoanalyst or hypnotherapist, you have to first be a good clinician. Therapists have to use their clinical skills, knowledge, and wisdom in order to affect healing for people and in order to create a healing experience. So a lot of times, you know, there's a lot of people who call themselves hypnotists or hypnotherapists, but also a lot of times clinically trained people will do hypnotherapy with people and kind of toss out their clinical hat and not bring their clinical wisdom to bear. So the next one of the things that we can do in hypnosis is we can actually influence implicit memory. And implicit memory has a big part in mental illness. So we can edit and re-edit implicit memory and the effect of implicit memory when somebody is in hypnosis. And this is not possible in traditional talk therapy and things like CBT. Can switch now. Next one. So a couple things that we can do. We can disconnect stimulus response. We can literally unring Pavlov's bell using hypnosis. We can identify negative meanings. You know, if anybody's used CBT, we know that we're working with negative meaning in psychotherapy. These can be very rapidly identified, and the underlying meaning that drives the day-to-day negative meanings can be identified. And then another thing we can do is we can drain negative affect from the original memory, from the original trauma. Next. So then what we can do is we can use a whole variety of theoretical models. So if you do CBT, you can use CBT in hypnosis. If you use psychodynamic, if you use Gestalt, if you use TA, whatever it is you use, you don't throw any of that out when you're doing hypnoanalysis. You can use all of those tools and techniques when you're doing hypnoanalysis. Part of what happens is we create new meaning in subcortical areas of the brain. And part of what we do is we create new experiences that are neurologically vivid. And we know in neurology that neurons that fire together wire together. And the novelty of this new experience enhances learning, and we can develop a whole new library of implicit memory on which to base people's experience and behaviors, thoughts, and feelings in life. Next. So new research evidence is coming out using not AAMH technique, but actually techniques that we use in the context of AAMH in our training and in our practice. Using abreaction with therapeutic interventions we're getting lots of new evidence that hypnoanalysis lasts longer than cognitive-based therapy. So people may have equal levels of change by the end of therapy, but at 4, 12, and 18 weeks, hypnoanalysis change lasts, whereas cognitive-based therapy falls off and people rapidly go back to the same levels of symptomology. So that's just barely skimming the surface of what I'm finding as I'm doing my research. So that's the end of my little piece here. So who's up next?
Okay, so we're going to have Dr. David Leskow talk a little bit about his experiences with last year's conference. I did mute you. So.
Okay, can you hear me now?
Yep.
Okay. I was the analyst last year in the conference, and we had a patient from Chicago since the conference was in that area. And this was a young Hispanic male who had been relocated from his home in Central America in a program of of protection because his mother's store was shot up during the night. So they literally got on an airplane and flew to Chicago during the night, leaving everything behind, leaving his friends and other family members other than his mom and brother. So he was suddenly pulled out of the culture he was growing up in and relocated to Chicago, where he was put in public school with very little language skills. And being a smaller child for the grade, he was frequently picked on and got beaten up on the way home, even beaten up by his older brother. And the family, the mother, who was the only one there at the time, did nothing to support or help him. So he was pretty low on self-esteem. He was pretty anxious about everything. And he had volunteered for the conference. So I felt this would be a good challenge for me. And we had a good opening experience. I got a good history on everything. And we did the first relaxation session going to a wooded scene, which he enjoyed. And then the second session of therapy under hypnosis, we did a word association test, which he did fairly well on, but I thought there were some more things that he could discuss. So I pushed him a little bit in the word association, and then he started to clam up a little bit. So we finished that session, and he had a break, and then we went to the next session, which was to be age regression. And when we started the age regression, he just clammed up. I was sitting right next to him on the stage, and I could see his mouth forming words, but he couldn't say them. He just mouthed the words and did say nothing for what appeared to be a very long time, since I was sitting up on the stage with him. At that point, I just gave him a tape on self-expression to listen to, and then ended the session, and told him in the hour break that he had that he could do some automatic writing about what was in his subconscious. And then we had a coffee break, and we were all talking about how we were going to get this guy to talk again. And one of the other associates that's also a senior training analyst, Mary Kuhlman, said, well, he's kind of anxious. There's that screen right there at the front of the stage. Maybe we could put the screen down and give him a little space between the audience and himself. And so when he came back, I asked him if that was okay with him, and he said yes. And then I asked him what he wrote. We lowered the screen, of course. So we had a little barrier between him and the audience of therapists. And he asked him what he wrote, and he said, well, that guy, I don't like that guy that's trying to push me to talk. And so, can you still hear me okay?
Yeah, that was good.
Okay. So I chuckled and I said, who's that? And he said, the therapist. And so, and I, after chuckling a little bit, I said, that's okay. And I gave him permission, of course, to be resistant. And then he relaxed, and rather than doing the usual formal induction into hypnosis, I just said, well, let's go back to that woods we were at earlier in the day, and just walk back in the woods and enjoy the scenery, see the squirrels and the birds and the trees, and smell the pine scent. And as we're walking back in time, and I just counted back the years from 24 back to 1 year at a time, and he came up with whatever was going on at that time. He came up with the arson incident that he got in trouble for, and leaving school at an early age, having trouble with his brother and the others beating him while he was going home from school. And then we went all the way back to birth and even into the womb, back to the first month of his mother's pregnancy, asking him what he felt and how he felt. And since he's connected to mom through the umbilical cord, he was able to say, well, I feel really anxious here. Mom's really anxious. And that went up 1 month at a time, and that lasted throughout the whole pregnancy. And he was anxious at birth. But as he was born, I asked him if he'd leave that anxiety that was mother's with mother. And he said, yes, he would like to do that. And so I may say that out loud, that he would leave that, or ask him to say that. You can't make him do it, but I asked him to say that out loud to himself and us, and he did. He said, I'm going to leave, Mom, I'm going to leave your anxiety with you. I don't need it anymore. And when he says it out loud, then it becomes his, because he takes it back in through his ears, and it can go to the conscious and subconscious. And so then we worked up through the years, looking at the incidents that were there. And I asked the adult part of him to help the child through the difficulties, be the adult for him, and the child, protect the child. And that was helpful to him. So he was basically reparenting himself with the adult part of himself. And that was helpful for him. And after we got through this session of age regression, we did several more age regressions back and forth through the years, looking at any traumatic events and asking him, whenever he's in a traumatic event, I ask him what he's feeling and what he's telling himself. Because what he says to himself in that traumatic event, or what somebody else says to him, is in the subconscious and sticks. And if it's a negative suggestion, which it usually is, then that needs to be changed. So I like to ask him what he wants to change that negative suggestion to make it positive. So if he can put it in his own words, then it becomes his. In other words, he reframes the emotional event. And as he reframes the event, he changes its impact on him. So that what was really traumatic just becomes an event that he went through without the emotion. In other words, the hypnosis is really to get to the subconscious so that we can release the emotion of the event, change the interpretation, reframe it so that he can learn from the event and then release it and let it go. And that's the whole process that we find most effective, is to use hypnosis to get to the traumatic events in an emotional state, release the emotion, find what they are telling themselves or what somebody else is telling themselves about them, and then they reframe it and release it. And this guy, I think we had 9 sessions, and by the time we finished the 9th session, summarizing it all, going back to the birth and forward again, he felt pretty good. And so I asked him, could he answer some questions from the audience, and was it okay to raise the screen? And he said, sure. And after we raised the screen, people raised their hands to ask questions, and he took the questions. I didn't do anything. I just sat there and enjoyed the feeling of having the energy from him and the audience, and the fact that he was now not so shy. He was now able to deal with the audience that he did not know and answer their questions about how he felt and what happened during the sessions. So he was markedly different after those 9 sessions than he was when he came in the first day to start the therapy. So what we're demonstrating in these annual conferences is that we can make a vast change in a person in 9 sessions. We're not saying we're done. He will need follow-up and reinforcement, but we can make a vast change in the person just with those first 9 sessions when we use age regression, get to root causes, help them change their thinking emotionally, and then be a new person. Now, they have to practice self-hypnosis and relaxation, and they have to practice their new skills, and they do need follow-up, but we can make a vast change, and that's what's so exciting about this therapies. We can take somebody with a big issue and help them through it quickly. And in family practice, I see a lot of many different things that like this week alone, I saw somebody with night terror, somebody with insomnia that couldn't sleep even with sleeping meds, and a lady that couldn't drive in the snow. So, there are things in family practice that we can deal with that we can't deal with medically with medicines. I mean, these people have all failed medicines and all kinds of other therapies for this, and they will start therapy with me, and hopefully within 9 or 10 sessions, they will be different. Any other comments or questions about what I've just gone over?
One thing that I just will add was, a lot of times we deal with clients who are resistant or maybe aren't doing their homework. And with hypnoanalysis, we can find out why really fast and get that resolved. And, exactly what David has been saying really resonates with what I've been finding in the research.
Yeah, I mean, in this case, we had a lot of resistance at the 4th session of the seminar, and I wasn't sure what I was going to do, but being in an altered state with the patient, I always know that the right thing will come to me and we'll be able to resolve it. And if you stay relaxed, your subconscious connected to their subconscious will help you through whatever comes up. You just have to go with the flow and trust that the information will come as it's needed. And that's a leap of faith that's hard for new therapists to do. But if you can master it and just be open, things will come to you that are helpful.
Is it my turn?
Yes.
Sure. We'll go ahead and move on to the next section.
Okay, let me just say a couple of things about that. I was the analyst at the conference here in San Antonio the year before, and it was an entirely different client patient that I was treating than David treated, and it went very differently. And that's one of the beauties of the conference, is to watch a volunteer client getting therapy in a very brief period of time and seeing the changes in them very quickly. That's really what sold me on it. I had been doing hypnosis since the early 70s and actually doing training sessions to help people learn to do hypnosis. And then in 1994, I went to an American Academy of Medical Hypnoanalysis conference here in San Antonio. And I saw Dr. John Scott Jr. Treat a patient in front of the group. And I was blown away. I was just saw how quickly somebody could change. And I immediately began to use some of the methodology in my practice the very next week, actually. Now, I wasn't a completely trained person, but I still got results from just going to the conference. And I got so many results that I decided that I would sign up for the training, the official residency program. And that's what I'm supposed to tell you about now. And the residency program is really very unique in that in order to be a resident, of course, you have to be licensed, and you can look on our website and see all the details of that. But people who are MDs or MSWs or LPCs or LMFTs or I think a psychologist, I keep forgetting psychologist, I'm sorry. That we all can go through the training. And the training is hypnotherapy, but also hypnoanalysis. And in other words, somebody can start by never having done hypnosis ever before, except in the basic 101, we call it, or the very first day of the training. But after that, they can come and go through the training with one of us. And the three of us here, and we have some other folks who are trainers. We actually have people come to our office and observe us as we do analysis with actual clients. The clients are very good about letting the residents sit in on the training. They're very good about sharing with them what they feel is happening or not happening. And it's a really good way of introducing people to hypnoanalysis and how it really works in the real world. I happen to kind of specialize in trauma related. I see a lot of people who have been in car accidents or sports accidents, things like that. I have two people I'm working with now who were hit by automobiles and as pedestrians, and I'm working with their trauma related to that. We have and a variety of other folks too, with people who've had trauma as children, as David mentioned. And when you're working with the trauma, there's all kinds of methods to work with trauma. But what we found is that a lot of those methods are temporary. They help up to a certain point, but hypnoanalysis actually changes the brain, as Jeannie was saying earlier. The brain actually changes, therefore the person changes, and they don't have to keep going back to that and going back to that because they've actually made the changes that are necessary. The levels of training are up on the screen. Level 1, hypnoanalyst, and level 2, hypnoanalyst, and in level 3, you actually become board certified. And the basic difference is that level 1, you're getting your own analysis for one thing, but you're also observing and getting used to how you're doing it, how we do it. And then level 2, you're beginning to use it in your practice or wherever you're working. In level 3, you're really using it, and we do a lot of help. We will help you as more supervisors during that period of time to make sure you're keeping the records clear, and you can call us, you can check with us. Even after you've gone through the certification, you can call any of us and talk to us. I know we have a person who's very well qualified, who's been doing this and board certified for several years. She calls me and Dr. Leistokow, I know, about specific clients that she's working with because she has some very difficult ones in her particular area. Now, the practicing and training analyst is someone that's Jeannie and David and myself and Mary Kuhlman and others who are actually practicing hypnoanalysis on a daily basis, and we are training analysts. We're people that you can come to our office and be a resident here and work with us. And that is a very unique experience, I believe, and also one that I have been told by everyone who's gone through this training to be very helpful. If you would like to talk with some of the people who are going through the training, we can arrange that. If you would like to talk to us more specifically about some of this, please get in touch with us. You can look on the website and get the links. You can get our phone numbers and our email addresses to do that. Is that enough, Wendy?
Yeah, that's fine. Just one other follow-up. There also is a video with some testimonial from people that have attended the conference and their experiences and impressions of that, and that's on our YouTube channel.
I'd like to also mention that we have two things planned here in San Antonio. March 31st is a one-day training, and that's the basic hypnosis training that we do, an introduction to age regression and that sort of thing. And it's here in San Antonio. And then end of April, we have the actual conference. The first day of that is the same one-day training if you didn't make it to the March 31st one. And then the other days are Friday, Saturday, and Sunday are the advanced training where you actually watch, in this case, Jeannie Clark be the analyst for a volunteer client, and she will take them through the protocol, and you'll be able to see how it works right on. But you also hear presentations by a number of people in the organization who've had a lot of experience in this modality, and some like have done some research. And that's one of the things that we're really happy about, that Jeannie Clark is doing the research she's doing, not just because she'll be a doctor, but also because the research will be very helpful to a lot of people in the field. So,
can I add one comment? In the reading I'm doing, I've been reading people who are working and members of AAMH and some other hypnosis organizations, and one of the comments that they're making is that their training really needs to change, because people will go to those training conferences like our one-on-one conference or our one-on-one class and get very excited and want to use it, and then by a year they're not using it anymore. And so this training where you're actually being trained, being supervised, watching the ups and downs of a hypnoanalysis practice, I think really is what it takes to get people actually using hypnosis in their practice. So, and we've had people from AAMH and some other organizations come to AAMH and just say this is much more in-depth and much more substantial. And part of what Don was talking about was in the presentations at the advanced course is we'll give you a theoretical model that dovetails very well with the neuroscience, but also a theoretical model that makes sense of what you'll see when you're seeing the client.
And also when we're doing the client, there's almost always an hour between each session with the client where we discuss what was just done or what's going to be done next, so that people have a chance to ask questions about what we're doing and why we're doing it.
mm-hmm. Mm-hmm.
Sure. So any last thoughts or comments, and then we can go ahead and open up the floor to any of our guests that have joined us today.
I'd just like to emphasize one thing, and that is that no matter what a therapist's background is, what they practice on a daily basis, they can still use all of that with hypnoanalysis. I have been trained in all kinds of different things that I was using before I was trained in hypnoanalysis. I still use most of those methods here in my practice in San Antonio. And some of the people I've trained have been trained in rapid therapy. I'm trying to think what it's called now, but a number of things that they've been trained in, and they still use that. It's just that with hypnoanalysis, with this protocol, they can get things done much more quickly, and also it's much more permanent for the client.
And that's what the research is showing too, that almost anything you do when a client is in hypnosis works better than when they're not. And I haven't seen anything in the research that I've done that, contradicts that idea. And I will just say, one of the reasons I got into this was I found it so incredibly exciting that people could get better so fast. I remember when I was a talk therapist, just being discouraged that, you talk to somebody for 4 years, we're still talking about the same problem. And I definitely have clients, because of the nature of the problem, who are with me for, longer than 20 or 30 sessions, but we're not talking about the same problem anymore. They're moving on to other issues. And I still find it very rewarding, energizing, and, even on my busiest weeks, I may be tired, but never feel burned out.
That's right. You can get a lot of energy from this process so that you don't burn out. One thing that comes to my mind is that people doing this can't be on tranquilizers like Ativan or Xanax or any of those. I've done some work with those patients from time to time, not knowing they were on them because they didn't bother to tell me, but it's kind of like Groundhog Day. You can have a really good session with breakthroughs, and patient comes back the next week and you ask him how to feel after that last session, and they don't remember the last session because they have short-term memory loss from the tranquilizers. So they have to be off of those drugs when they do the therapy.
You know, David, I have slightly different finding, and that is that if people are on some of those tranquilizers, the therapy just takes longer. I've had a couple clients who were on, I had 2 clients that were on the highest doses their doctors would allow, and it just took longer.
Which drug?
Xanax. And one that's on Ativan right now, but both of them, I mean, they just hung in there, and eventually, you know, both of them are now anxiety-free and actually working with a psychiatrist to get off those drugs, which is a whole nother process. But it just takes longer because of the memory problems.
Okay, well, that's good.
Yeah.
Okay. Well, I probably don't have as much patience as you do. So, okay, that's good.
From our guests in regards to any of the comments or anything that was shown today? You guys are on mute if there's anything.
I'm a certified hypnotist from ASH and from another organization as well. So I've been using hypnosis for a long time. And this is a different application. So I am quite interested in getting more information on it. So I'm already on the email list. I guess that will get me the information. You have a conference every year?
Yeah.
Okay. Is there
San Antonio next year will probably be in the Chicago area.
Okay. Is there a journal or any kind of publication on within the organization on the work that's being done?
We don't have very much up-to-date information. There are some online publications. If you go on the AAMH website, there is one publication that was published by an international neurocognitive research in 2014 that actually gives pretty good information.
Okay, great.
That article does, yeah.
Thank you.
And Betty, let me just say that I live in San Antonio, and when I moved here in 1980, I never thought I would stay, and I'm still here. So it is a really good place to visit. And in April is a great time to be here. So come on down and visit us, and you'll enjoy it.
Well, the residency program sounds like a bit of a barrier since I'm on the East Coast and the rest of you are not.
Well, we have other ways of dealing with that. Dr. Leistokow is willing to travel, and we can talk to you about all of those things. The first step, though, is to come to the conference and make sure it's something that would be helpful.
And in fact, we've got a resident right now that's coming from California.
Right.
Oh, okay.
And so we do have ways to work around that.
Okay, good. Thank you.
So I have a lot of questions. I'll probably call one of you, but my main question is, after the training, like in April, after the workshop, are we able to go back to our office and do anything, or is it mainly a theoretical structure that doesn't prepare us to actually use the education?
I think I can answer that because when I took the conference in 1994, Monday morning, I was using it. Now, I wasn't using it as well as I do today, but I hope. But I was using a lot of the methods immediately and was getting results immediately. And that's the reason I went through the residency program, is that I figured, well, if I can get results with only going to one conference, what can I do if I take the whole residency program?
Mm-hmm.
Okay.
The training is actually very active and involved. The 101, there's a lot of demonstration and practice. And in the advanced course, you're really actively involved, not so much in the actual therapy process, but in using some of the tools. And so it's pretty active, involved, a lot of discussion, a lot of opportunity to ask questions and be involved with the process. I also started using hypnoanalysis pretty quickly, but I also began the residency program immediately. I got home on Monday and called Mary Coleman, and Wednesday was in the residency program because I really wanted to learn how to use the tools and to learn how to use them effectively. So Donna and I took slightly different tracks there, but with the residency program, we give you tons of demonstration and supervision and materials and assistance and support and all kinds of stuff to get you up and going.
Okay.
I had to figure out how to say something. I don't know if people are hearing me.
Yes,
Yes. So I'm in the residency. I'm Diane. I'm a psychiatrist in Beverly Hills, and who likes to do psychotherapy. And I was just so taken when I went to the conference. I highly recommend it. And I've been to Chicago. Actually, I've been able to go, and it's just been wonderful training. And everyone in the organization is really, really helpful, smart, nice, down to earth. I've been using it with my patients, and of course, the more that and I have very difficult, very ill patients, and the more that I do, the more that I learn about it, the better it gets. But I started with the whole concept right away. And anybody that wants to talk to me, I'm happy to talk to them.
Great. I remember you at the conference, Diane. You asked a lot of questions and you got a lot of information, and I enjoyed having you there.
Yeah. Everybody was so helpful. It was just really like life-changing. It's been doing this.
Anybody that is on?
I would just like to add something that Diane, this is Peggy, that Diane said we had asked her to kind of give us her feelings on how she felt about the conference and her residency and her training. And she said that when she first looked at the material to think about going to it, she said, this is just too good to be true. But she did come to it, and she said, it is absolutely all true. So I just wanted to, that was a good to hear.
Yes.
You know, one of the responses that people have when they see the results of hypnosis is it's too good to be true. That's what people think. And it's one of the reasons why there's been so much controversy around hypnosis. But, you know, there are limits to what it can be used for. But for what comes into my office most of the time, I get, compared to what I used to get as a talk therapist, and even compared to, I used hypnosis before I came to AAMH. I still surprised and delighted with the results that I get.
So another question. So are you age regressing everybody that comes into your office? Is that part of the main?
Yes.
So that's the main.
Yes. And one of the dangers of hypnosis is that people can go into an abreaction, and we actually use that as a benefit and use that to speed the process. So yeah, we very much do use age regression as a routine part of the process.
And are you always going back to birth?
You know, I almost always at least touch on a birth or pre-birth regression. Almost always there's something there. There are different theorists who have said that, I think Adler may have said the first trauma is birth. So there's plenty of really good theoretical work done that's important. But also what we know is that the part of the brain, one of the main parts of the brain that we're dealing with, the amygdala, is fully mature at 7 months gestation. So we know that the kind of implicit memory that we're dealing with is being conditioned even before people are born.
That first 9 months is really exposure to mom's issues. And so I find it it pretty important. And I usually always go there. But, you know, when we take the history awake with the patient, there's always some things that come up under hypnosis and age regression that didn't come up in the history, because that's subconscious stuff from earlier life stuff that's not consciously recalled. So if you want to get all of it and get the root cause and get people totally over their problem, you generally have to go back to the beginning of the problem.
Any other questions?
Okay, so what we're gonna do is we're gonna go ahead and pause this video. We're gonna upload it to our YouTube channel. We'll be sharing it in future email correspondence, so that way you can refer back to it if there was some information that was missed. Our website at the AAMH is a great resource. It has a lot of information about the training and follow-up if you're interested in the residency as well. Again, Peggy is our gem of communication and information and coordination of the AAMH. And go ahead and keep an eye out for our communications via email. We really enjoyed having you all today and appreciate your interest in the organization and hope to overcome any barriers if this interests you.
Thank you.
Thank you.
Thank you.
Thanks.
Thank you.
Thank you.